Now is the time to get your child's medical appointments in order. Things like vision problems affect their learning abilities in school and should be checked. And my first guest is an expert in identifying vision problems and finding the best resolutions. Exams at an early age are crucial. Dr. Mary Fugerson is with Eye Surgical and Medical Center. She joins me this afternoon. Dr. Fugerson, it's nice to have you here.
Thank you, Gail. It's lovely to be here.
It's interesting that we were talking about both of our own, obviously I wear glasses, and you know,
I do.
When we were younger, we didn't know what we couldn't see. You know,
Right.
when you're a child, you don't know what you can't see, and that's kind of a problem.
It is, because they can't tell you if there's a problem.
You don't know what you can't see if you don't know what you can't see, you know?
Exactly.
So what age is a good age to start to screen children?
The American Optometric Association actually recommends between 6 months and a year for their very first actual eye exam. It goes above and beyond the pediatric exam. And then the preschool years, so about age 3 is when we start looking again.
That's interesting that you said above the pediatric exam. So you're talking about more detailed vision testing?
Not only vision and not only health. The pediatric exam is looking for health, retinoblastoma, things like that. But then vision, we're looking for developmental issues as the child and their prescription continue to grow and change. So we're trying to catch them early, make sure that there's no problems there.
How early? Preschool age?
Preschool.
Really? Can they even tell you what they're looking at or what they're seeing?
Absolutely. A lot of the tests that we do don't rely on their feedback. We can actually assess their prescription without their feedback. And then they do great jobs at playing games. They don't have to read the eye chart. They can read a shape chart. They can tell us if they can see shapes on a board and things like that. So it works out great.
Why is it important to identify them so early, especially if they're not in preschool age going to be reading anything on the chalkboard, they're not driving? You know, what's the benefit?
A huge benefit is that they're developing quickly, and they're also entering school. And so if they're behind developmentally, or if they're behind or getting behind in school, it has not only learning aspect issues, but it also has issues with or can create issues with self-esteem and social issues. And so early is best.
It's interesting that you note that, because I think when parents see their child struggling in school, vision isn't one of the things that come to mind as could be the issue, unfortunately.
It's not. And it's disappointing, because so much of what happens at school is visual, and so much of your learning is done visually. It's crucial to make sure they do good.
You go to schools and screen kids right there at school.
We do. We go to preschools. We're screening for a couple of key areas. First, obviously, we want them to see sharply, so we don't want any blur. The second thing we're looking for is any risk for amblyopia. So amblyopia is a disease that it's a functional disorder that we need to fix before age 7. And so if they can't see clearly, we need to make sure that we eliminate the reason why and get that fixed before age 7. So we're looking for whether they can see stereoacuity, see depth perception. We're looking for whether the eye has a slight turn in or out, or a large turn in or out, which is not easy to catch unless it's a large deviation. So it needs to be checked specifically.
Those are good points, because I also think parents only think about the fact of it they can see, not some of those other issues that could be eye issues, eye problems with the eye itself.
Yeah, absolutely.
You are going to have a block party event, and I'm excited about this because it involves you and another dentist in the availability that you are making yourselves to the folks in Westerville.
Absolutely. You can come talk to us and ask us questions. We have the event next Thursday, which is August 8th. It is from 4 to 7, and it's a block party. We're having food. Bring a condiment to donate, and you can have dinner and bring the kids to the bounce house, face paint, balloons, and let them have a good time and wear off some of their summer energy before bedtime.
Well, what's the idea behind this? Why did you, and then I think you're partnering with Copeland Mill Dental.
Copeland Mill Dental.
So the two of you are going to be offering advice to parents?
Yes, we'll have tables there, and you can come up and talk to us and ask questions and meet us and see what we're about.
Is that a good way for you to maybe get parents and their children engaged when they may not have thought about, you know, dental issues in preschool age, eye issues at preschool age?
Absolutely. It's a great way. You don't have to come into the office and sit for an exam. You can come meet us, talk to us, and get to know us first and get comfortable with what your child's eye exam would look like. And so come talk to us. We'll happy to help you.
And it's a benefit too. Who's it benefiting?
The Westerville Area Resource Ministry, or WARM, and so they've asked for condiments, so ketchup, mustard, things like that. So if you could bring a donation, you can come have dinner and have fun with the kids.
Well, once again, we want to make sure that everyone knows where and when. It's Thursday, and it's August 8th, 4 to 7. There's the address on Cleveland Avenue, and of course, bring a donation to WARM. It's a pleasure to meet you, Doctor.
It was wonderful to meet you. Thank you so much.
And keep doing the good work for our kids.
Thank you.
Thanks.
Thank you.